everyone. Welcome back. We are going to talk about a new and interesting topic because we just finished kind of wrapping up our discussion on exercise and movement, and balance was our last episode. So today we're kind of combining a little bit of science corner with what would you consider like up-to-date
Mhm.
medical info, right? Because we're going to
Yeah.
talk a little bit about studies and stuff. So what is on everyone's mind today, Dr. Sarah? What have you been
Oh my
thinking?
gosh. I am so excited to talk about this study. So this is like such a badass study. So this is put out about tirzepatide. So this
Mhm.
is Manjaro and Zepbound. But basically what they found, so let me just back up. So we're talking about obstructive sleep apnea. And
Okay.
what often happens for people who snore or if people have certain risk factors, including obesity, is that when they go to sleep, and maybe you can describe this a
Mhm.
little bit better than I can as an OBGYN, but their like soft palate or something or tongue or something like that like relaxes into
Mhm.
their airway, which can close off their airway just a little bit.
Yes.
And it can happen. So it happens to everybody when you sleep, but most people have a large enough airway that even when that relaxes a little bit, you can still breathe.
Mhm.
However, if you have certain risk factors, including like if your neck's a little bit larger, then your on the inside is a little bit smaller, and it can lead to obstructive sleep apnea,
Mhm.
um, and snoring.
Mhm.
Um, and and so anyway, long story short is we have no treatments for obstructive sleep apnea. We can give you CPAP, which
Mhm.
CPAP blows a little bit of increased pressure. So if you have like as you relax and have like less like mechanical stuff to hold open your airway, we can like puff air into your face and like increase it from the inside out and
Mhm.
increase that volume or that pressure on the inside. So that is a way to like put a band-aid on
Yep.
your OSA, your obstructive sleep apnea, to like keep that open, but it doesn't like treat it. Like we have tried and there has like been nothing ever in
Mhm.
the entire history of medicine that has like treated obstructive sleep apnea other than like weight loss, which nobody has been able to effectively do before this.
Right.
So anyway, so that brings us up to date to now this new trial that just came out last month. Um, that basically tirzepatide, yes, it works because it promotes weight loss, which can decrease this circumference of your neck and blah 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 blah.
Mhm.
But even independent of weight loss, it
Mhm.
has been shown to decrease the number of like AHIs, which basically that's like the event where you are like obstructing your airflow. So basically, an AHI event, according to the blah 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 Sleep Medicine Association or whatever it's called, it's an AHI, which is the event that we're talking about, is a 30% reduction in airflow for at least 10 seconds. And when your O2 drops by 4%. So say if you're like sleeping and your normal O2 whenever you're asleep is like 94% or whatever it might be. And let's say you have one of those events. And at that time for 10 seconds, your O2 drops like say to 90%. And
Mhm.
it's 10 seconds that you're not able to get air in. So that's an event, an AHI event. And so this trial, they basically looked at people who already had obstructive sleep apnea. Either
Mhm.
A, they were on CPAP, or B, they couldn't tolerate CPAP, because that's like another thing that like always gets overlooked is like, oh, we'll just give them CPAP, just give them CPAP. But like how many people don't tolerate CPAP because you have this like mask thing on your face
Yep.
while you're trying to sleep. And a lot of people, especially if you have even just like barely like a little bit of insomnia at baseline, or just like are real like me, if you're a little bit of a priss and you can only sleep in like the most perfect conditions, um like you can't sleep with these like goofy masks on, and some people can and they do fine, but a lot of people don't tolerate the CPAP machine. So anyway, so long story short, they basically ran two trials, or kind of two trials, but one is with people who did tolerate CPAP,
Yep.
either with tirzepatide or with the placebo. And then one was people who had tried CPAP in the past and weren't able to tolerate it, or they weren't able to afford it, or they, for whatever reason, they don't have it. And they weren't planning to take it. And so they ran a trial on them with tirzepatide versus a placebo, and the results were amazing.
Okay. So what
So
were the results?
yes. So in the group that was unable or unwilling for whatever reason to tolerate a CPAP, there were 234 participants. They started out, their baseline events per hour was 51.5, which, first of all, let's kind of think about that. That's almost one event per minute.
Yes.
So it's 51, almost 52, 51.5 events per hour. That's
Yep.
like almost one a minute. That is like, so if you're having a decrease in your O2 saturation every single minute, like that's really bad for your brain. That's really bad for like inflammation. That's like really bad for like everything else downstream. That's like why you
Everything.
feel like shit when you wake up. But
Yes.
anyway,
And with the headaches,
so
right? Yep.
yeah. So their baseline was 51 events per hour. And then the placebo almost didn't change, of course, obviously, as you would expect. But the people who were on tirzepatide, their events went down to 26. So it's like a half reduction.
50%, over
Yeah,
50% reduction.
yeah,
Mhm.
like insane. And then the people who were actually already on CPAP, they had even better um, results. So they actually dropped. So basically, they took them off the CPAP for the study, or not for the study, but like to do the measurement at 26 weeks and then at 52 weeks. So basically, like at 6 months and then at a year. They took them off for a week so that they could like find out, because obviously if you're on the CPAP, you're not having those events. But so anyway, so basically they started about at the same thing, about 50 events per hour, and it went down to 20 events per hour in the people who were already being using CPAP. So I mean that obviously, again, they weren't using it at the time of the study, but the point being is that like these are being people who are like being treated
Mhm.
with CPAP, which doesn't actually like treat anything. It just is like a Band-Aid. It blows open your airways. Um, and so anyway, it's phenomenal. But in addition to that, and again, these are like independent of the weight loss effect, they also had incredible improvements in all of their downstream effects. So we know that like this having sleep apnea causes systemic inflammation, it increases your blood pressure, it like does all of these other things that make you miserable and make you have a very low quality life.
Yes.
um it like really improved them. So several things. Number one, their blood pressures improved. Again, this
Mhm.
is independent of weight loss. This is like when you correct for the weight loss, this is not a weight loss effect. This is like
Right.
a getting good sleep effects.
Yes.
Their
Yes.
blood pressure went down. They had less systemic inflammation, which they measured that by doing blood markers. And we
Mhm.
can talk about that later. But I think blood markers, signs of inflammation is like something that is like really under tapped or under
Utilized.
we don't
Yeah,
do enough.
absolutely.
Exactly. We don't do enough of that in medicine. And these actually decrease their systemic inflammation.
Mhm.
Again, independent of weight loss.
Mhm.
Um, decrease their systemic inflammation, which is like going to help your whole entire quality of life improve.
Mhm.
Additionally, the patients got this like scoring sheet, this like, like when you wake up, how do you feel? Like, did you feel fatigued today? Did you feel like you got good sleep? Do you feel alert and energetic? Like, how do you feel
Mhm.
when you wake up in the morning? And their scores drastically improved. Again,
Mhm.
this is when you even correct for weight loss, they improved. So this is like so cool. And this is the first time we have ever had a treatment for obstructive sleep apnea ever that's like actually tried to go to the root cause of what
Mhm.
is going on. So it's really, really awesome. Sorry, I like
Absolutely.
totally monopolized
No, you're
that
good, but it is,
conversation.
it's very exciting because we're seeing, I think, more that what I think we've been talking about from the beginning is that these class of medications, these GLP-1s, are doing fantastic things for patients in all groups of medicine.
Yeah,
So even if, yeah, you don't have any extra weight, or you don't have type 2 diabetes, or you don't
yeah,
have this is wholly a different set of patients that
yeah,
maybe have chronic fatigue, maybe
yeah,
are complained
totally.
with chronic headaches, right? Because
Yes.
sleep apnea will cause that. It will also cause adrenal dysfunction because your cortisol level is crazy high because you're not sleeping. Imagine if literally someone was in bed with you and every, what is that, 45 seconds, they shook
Woke
you
you
really
up.
hard.
Yeah.
That is what it's like trying to sleep with sleep apnea, especially if you're having 50 something events, right? You
Yeah, an
can't
hour.
get into that delta sleep. You can't get into that deep REM sleep. So your
Yep.
brain is not able to go through its own kind of rejuvenation and rest and detox
Mhm.
period, and your body's
Absolutely.
not either. So
Yep.
it continues to progressively get worse, right? As we
Yeah.
get, and that's how we see this patient with sleep apnea develop chronic fatigue, metabolic issues, blood pressure, inflammation, obesity, things, and it just continues to pile on
Yeah.
because it's all right
Right.
interconnected,
Right.
which is what I think these medications will continue to show.
Totally.
But you also touched on really good info on the CPAP machine. So I have a lot of patients that have tried the big face mask and they can't handle it. There's a bigger portion of patients that really like this small nasal. So there is a
Right.
small little nasal mask, which is less, it takes up less real estate on your face. So it doesn't feel as obstructive, right? Because, right, it's just in your face and like it's just
Yeah.
loud. And so
Yeah.
sometimes your partner that might be in the
Partner.
bed with
Mhm.
you, or even a dog doesn't like the
Yeah.
sound of this pressure
Yeah.
kind of going off and the machine. And like you're already most likely having apneic episodes. And
Yeah.
apnea is basically a prolonged period of decreased breathing. And a lot of people will notice this when you see someone maybe in your family and they fall asleep on the couch and then all of a sudden they're kind of like off and then they jerk themselves awake. That's your body literally waking you up because your oxygen level dropped because you stopped breathing for so long. And it's
Yeah.
all because, right, everything's kind of closing off and your body trying to survive is like, no,
Yeah.
no, no, wake up.
Wake up.
But
Yeah.
you're constantly doing that at night, right? So it is very, very exciting to
And I know I
combine.
sound like a
Yeah.
GLP-1 apologist and that like I'm always, pro GLP-1s, and I'm not always pro GLP-1s. There are certain situations where they are not appropriate. But um I just think that this is like another point where this is like affecting like a holistic
Hmm.
approach
Hmm.
to improving your metabolic health. And this is something that all along, like maybe this isn't your fault. Maybe you just have a GLP-1 deficiency, And like I think this is just such a like beautiful finally moment,
Yeah.
if I can say that, that is like, okay, like medicine gets a lot of things wrong. But like we've we've made it with this guy. Like this is like such a like whole oh my God, why am I getting emotional about this? But like seriously,
Because
like it's
it's
yeah,
I think it's life changing for a lot of us, right?
yeah.
Not
And we've
only
been
as
gaslit for an entire, for time alive because I was diagnosed with overweight as a toddler. And it was like you've been gaslit by the industry and gaslit by medicine, well, that you're just like eating too much. Well, in reality, every single person on the entire planet, with some very, very minor exceptions, is eating ad lib to satiety.
Mhm.
Nobody can not eat ad lib to satiety. Well, I can't say that satiety. And but someone else's satiety is different than your satiety. And if your entire world has been without satiety and you've had this food chatter and nobody else has it, nobody else gets that.
Mhm.
Anyway, I'm off on a tangent yet again. But it's just so lovely to like make progress and to no longer be gaslit by, well, you just like don't like, you're just eating too much. Well, everybody is eating to satiety.
Mhm.
Um, and don't act like you're not. So anyway,
So I think we will continue to see amazing medical studies and results that
yeah,
are showing that these medications are really helping across the board, right? We've already seen it all the way from kidney studies, cardiovascular studies, right? We now have sleep medicine. We talked about neurological studies in the past. So everything it's touching, it's doing amazing work on,
yeah,
which we've not had answers to. And so it's interesting that this group is now making this connection, right? And bridging all these different gaps in medicine
Yeah.
that we haven't been able to touch yet.
Mhm.
So I think it's very exciting. I think will continue to be exciting. We'll continue to talk about these medical studies,